In this video I will talk about arterial stiffness and gut dysbiosis and what we can do with it, and because it's very important to keep us alive and healthy. Okay, as always I recommend you to download this presentation as PDF file from the link in the description. You will get access to the source of information, make your own research, and then decide what to do, because I am not medical professional. I cannot give you any recommendations. I do this research for myself. I am doctor in physics and mathematics, so biology is my passion. So I like it and I do this research mostly for myself. Okay, let's go. The phrase "you are as old as your arteries" highlights the link between arterial stiffness, aging, and cardiovascular risk. Arterial stiffness increases systolic blood pressure and reduces diastolic blood pressure, leading to cardiovascular disease. So you will see at this slide how the aorta and other big arteries are changing over time due to aging. So, and arterial stiffness increases with age, leading to elevated pulse pressure, a key marker of vascular aging. Elevated pulse pressure increases the workload on the heart and damaging capillaries in vital organs. You see the difference between elastic arteries and stiff arteries. In elastic arteries, the aorta is stretching and accumulate energy, which is produced by heart, and then it is using this accumulated energy to push blood due to diastolic stage. But in stiff arteries, the heart is overloaded, and also pulse pressures, and the pressure variations are very high. So what is the pulse pressure? You see here, that's how pressure is changing. Systolic blood pressure is maximum blood pressure, diastolic is minimum blood pressure, and the difference is so-called pulse pressure. Pulse pressure is actually defines your biological age, of the cardiovascular system. So elevated systolic blood pressure and pulse pressure increase the workload on the heart and lead to greater risk of damaging capillaries in vital organs such as brain, kidney, liver, and lungs. It is associated with increased risk of overall mortality rate in various populations. Okay, you see here that if blood pressure in range of 100, the mortality rate from cardiovascular death is very low. And I have now I have systolic blood pressure 100, and so you see overall death rate is higher because it also includes other infections and other causes of the death. But again, it's very important to keep your systolic blood pressure low, and for this you need elasticity of the aorta. What can we do? The most easy way is to use some standard medications to reduce blood pressure and to reduce systolic blood pressure. And I will talk about two very common antihypertensive drugs, which is losartan and hydrochlorothiazide. Okay, so it is again you see chemical structure of these substances, and it is really interesting. It's really very cheap. You can in Thailand you can get it you can buy it online or in local pharmacy without any prescription. So it is really cheap. So the combination of losartan and this hydrochlorothiazide is working synergistically in reduction of systolic blood pressure. It is not changing much diastolic blood pressure, because diastolic blood pressure over time due to aging it is increasing. So it is again, it is decreasing. So pulse pressure is increasing. So changes in the diastolic blood pressure is only because of the agents here, you see, but it is not changing it. Only systolic blood pressure is dropping a little bit, but this trial was done with no change in the diet, and so it's really, you see, it is not a miracle, but certainly there is some improvement in the blood pressure with this combined intake of the losartan and this hydrochlorothiazide. thiazide. In normal doses it is 50 milligram losartan and 12.5 milligram of this hydrochlorothiazide, and this is a standard pills you can buy, and if you take it in the morning once a day, it's you see that it is working quite well. What else? Dysbiosis of the gut is imbalance in the gut microbiota, and it can compromise the integrity of the gut barrier of the epithelium layer, allowing plant proteins such as gluten and pathogens and bacterial toxin pathogens, including bacteria and also viruses, and also bacterial toxins to enter to the bloodstream, and this is actually creates chronic inflammation in your body. It is accelerating, it accelerates aging, and this is the main reason why you are living so short. So in healthy body, it's this epithelium layer is cannot be penetrated by these toxins and other substances, but when pathogens multiply in the gut, then we have transport of this polysaccharides and then also other toxins to the bloodstream, and also short chain fatty acids are not produced in the gut, and short chain fatty acids are very important for health of the gut. Okay, and when toxins are getting to your blood, they can get through your blood-brain barrier also, and then create inflammation in your brain, and with all consequences like Alzheimer's disease, amnesia, and all also central nervous system is working not properly. So it's again very important to avoid this. So dysbiosis has to be treated somehow. What else? The primary bile acids that also you have to take care about them, and they also very important. And after the synthesis of them from cholesterol and hepatic tissues in the liver, they are secreted into the intestinal lumen to help in digestion of fat. And most of these primary bile acids are reabsorbed already in the thin gut, and then reused actually, but some or amount of the primary bile acids get to the colon and changed by bacteria to the so-called secondary bile acids, and if they are changed, they can get also to the bloodstream, and it is actually not so nice, not so good, because they damage, the secondary bile acids can damage liver. So how to treat dysbiosis, and the dysbiosis is to avoid these changes in the gut microbiota. Dysbiosis can be addressed using probiotics, prebiotics, fecal microbiota transplant, which I don't recommend. It is really not nice. But in also specific healthy diet and select and what we are talking about now, some tetracycline class antibiotics can be very helpful, easy way to improve your microbiota. Okay, we are talking about doxycycline in particular. Doxycycline improves dysbiosis, and prevents cardiovascular pathology, improves gut barrier integrity, and attenuates hypertension in rats. So it is again very interesting. So if rats have high blood pressure, so you see it goes like this, but if they also treated by doxycycline, the blood pressure eventually go down and to the level of normal blood pressure in the rat. What is also quite astonishing and quite surprising, that intake of doxycycline improves elasticity and make the main arteries like aorta more elastic and more soft, and also softer. So you see here, you can compare the structure of these elastin fibers in the aorta, and compare it with control. Control is here, and you see that this is compared with this, and especially with this. This is the control, I mean healthy rats, but this is the rats which have deficiency of elastin fibers, that you see here and here, very big difference. So treating them with doxycycline, and doxycycline better than other antihypertensive drug like atenolol. This is again astonishing that tetracycline antibiotic can help to recover elasticity of the aorta. This is absolutely fantastic result in my opinion. But moreover, we know that the aging of the adaptive system results in decrease in functionality, also called immunosenescence. Immunosenescence happens in our bodies, and what is happening, the thymus is changing in the size, and also functional tissues in thymus are replaced by adiposity tissues. So it's again it is big problem. And so it is, all this process has name involution, and this involution characterized by decline in the epithelium cells of the thymus, increased fibrosis, and replacement of these functional tissues with adipose tissue. And again, quite astonishing that doxycycline has potential to attenuate the senescence of this involution of thymus, and improve function of the thymus through its anti-inflammatory, antioxidant, immunomodulatory, and anti-fibrotic properties. It's again quite astonishing. So we are finishing with this short video. Again, I don't give any medical advice in here, but you can do your own research and decide. But I personally, I was taking Losartan, and so it was not. I have quite good blood pressure, so it didn't change much. Maybe my resting heart rate a little bit increased with Losartan, but I didn't see any big improvement. But when it is combined, with this pardon. When it is combined with hydroxychlorothiazide, I see that systolic blood pressure reduced. So, and again, I have to do it long term to see, and let's see. And in long term, it should not only change the systolic blood pressure, but it also has to improve structure of the aorta. So I hope, and this improved structure of the aorta, it relates to younger age. So I believe that somehow doxycycline, especially combined with other antihypertensive drug like Losartan and hydrochlorothiazide, it makes actually miracle. So very cheap and very easy, affordable medications. Okay, thank you for your time, and watch next time. I will upload a longer video for with references to sources for information. Okay, take time and take care. Ciao ciao.